Welcome to Chapter 14. This video is going to include sections 14.1, 14.2, and 14.3. All of Chapter 14 is about the human brain, which, of course, is extremely complex. Brain function is the thing that determines if you are alive or dead from a purely clinical point of view. We didn't always know how important the brain was. Way back in very early medical history, some people, Aristotle specifically, thought that the only job of the brain was to cool the blood. Was Hippocrates, actually before Aristotle, who started to envision the brain had a more important function. So here we're going to be talking about the different structures of the brain and the different cranial nerves that are directly connected to it. And we'll talk a little bit about the evolution of the central nervous system and talk about the spinal cord and how the brain's evolution is related to vision, to memory, to the motor skills that we have superior to most other mammals, and also the prehensile hand. So, starting with section 14.1, we're going to look at the major subdivisions of the brain and some of the really obvious anatomical landmarks that you'll want to know. We'll talk about the difference between gray and white matter, and we'll talk about embryonic development of the central nervous system and how this relates to the anatomy we see in the adult brain. So first of all, rostral means towards the forehead, or a bit more literally towards the nose. Caudal is how we'll describe the back of the skull or towards the spinal cord. The human brain weighs about 3.5 pounds in men and just a little bit less in women, has 3 major parts. 83% is made up of the cerebrum. This includes the cerebral hemispheres, all of the gyri and sulci that are on the surface, the longitudinal fissure that splits the brain into the left and right hemispheres, and the corpus callosum that integrates the left and right hemispheres. The cerebellum is much smaller, but contains about 50% of the neurons. So it's the second largest brain region, and it's located posterior in the cranial fossa, in the furthest back portion of the skull. And then the brainstem is the portion of the brain that remains if we were to take away the cerebrum and cerebellum. It is made up of the diencephalon, the pons, midbrain, and medulla oblongata. So the longitudinal fissure is really obvious. It separates the left and right hemispheres right down the middle. And the corpus callosum is a thick bundle of nervous tissue that holds those two hemispheres together. Gyri are the folds that we see in the brain, and sulci are the grooves between the gyri. So the cerebellum is in the front part of the brain, front part of the skull. So if you guys remember when we looked at the bones of the skull, we kind of have 3 divots in the base of the skull if we were to look from the top down on the inside. The cerebellum takes up the posterior one. It also has gyri and sulci and medial fissure. The cerebellum only takes up about 10% of the brain volume. Okay, so the cerebellum is this part back here, the cerebellum. And then the brainstem is this portion here. And its major components are the diencephalon, the midbrain, the pons, and the medulla oblongata. So we can generally divide the brain into gray matter and white matter. The gray matter gets its color because it has very little myelin. We've talked pretty extensively about myelin in previous talks. So then white matter has myelation. So the gray matter is going to be the neurosomas, the dendrites, and the synapses. And it's going to be the surface layer or the cortex that is covering the cerebrum and cerebellum. The white matter is deeper in the cortex and has opposite relation to gray matter of the spinal cord. So like we just said, the white color comes from myelation of the nerve fibers, and like we've talked about with the spinal cord, it is composed of tracts or bundles of axons. So now we're going to talk about how the nervous system develops in fetal development. So the nervous system develops from the ectoderm, which is the outsidemost layer of the embryo as it's dividing after it's fertilized. So we're talking very, very early in fetal development. This is the 3rd week of development, generally before a human female even realizes she's pregnant. We have the dorsal midline of the embryo thickening into what we call the neural plate. As this thickening happens, the neural plate sinks down into the ball-like structure and the edges thicken, and this forms what we call the neural groove. And that neural groove folds and fuses and forms a hollow tube by day 26, so before we hit the 4-week mark of gestation. And we can see a little bit of a picture here. We've got the neural plate, this flat region, and remember this is the ectoderm, this is the outside surface. So the neural plate and then the neural crest on either sides. This neural plate is going to sink down. We can see the sinking here at about 20 days. That's going to kind of pull these neural crest areas together. As the neural crests pull together, eventually they're going to touch and form the neural tube. So the neural crest is a longitudinal column on either side of the neural tube. And again, very important, I want you guys to know this, it comes from the ectoderm. As it rises up, it's going to eventually touch together, and this is going to eventually become most of the peripheral nervous system. Then the neurotube is going to have 3 vesicles, or kind of developing sacs of tissues at the anterior end, near what will eventually be the fetus's head. And those 3 vesicles will eventually become the forebrain, the midbrain, and the hindbrain. Those 3 vesicles will divide. So here's your 3, 1, 2, 3. Between the 4th and 5th week, they're going to divide into 5, 1, 2, 3, 4, 5 discrete vesicles. So we're going to have some differentiation going on in both the forebrain, becoming the telencephalon and the diencephalon, and the hindbrain becoming the metencephalon and myelencephalon. Moving on to section 14.2, here we're going to be talking about the meninges, the different ventricles, cerebral spinal fluid, and the blood supply to the brain. So we're going to be able to describe the meninges. We're going to talk about what chambers are fluid filled in the brain and why they're there. We'll talk about how cerebrospinal fluid, CSF, is produced and circulates and fills those chambers. And then we'll talk about something that's critically important, the blood-brain barrier. So we've mentioned previously the meninges are 3 layers of connective tissue that separate the nervous tissue from the bone of the skull or the vertebral column. Like we talked about with the vertebral column, we have 3 distinct layers, the dura mater, the arachnoid mater, and the pia mater. And these are protective structures. And they also provide some support structure for veins and arteries that are going to to supply oxygen and carry metabolites away from the brain. So the outermost of these three layers is the dura mater, and the dura mater actually has two layers within itself. We have the outer periosteal, that's going to be very close to the bones, and the inner meningeal, and this is going to be close to the arachnoid mater. The dura mater is pressed up against the cranial bones. We don't have any extra space there. Though it's not directly attached to the bone, except in a couple certain places. We have folds that kind of extend the dura mater into different spaces of the brain, and you can see which specific structures those inward folding places are. So our middle layers, the arachnoid mater, and then our innermost layer is the pia mater. The arachnoid mater is transparent, and we have a kind of a little bit of a space, the subarachnoid mater, that separates the arachnoid mater from the pia mater. And then the pia mater is very thin. It kind of forms itself into the contours of those gyri and sulci. It is so thin that even if we're looking for it, we can't see it without a microscope. It's extremely thin. So a particularly devastating disease is meningitis. Meningitis happens when those one or more of those three meningeal layers gets inflamed. Can be very, very serious, especially as the brain is developing from infancy to toddlerhood. Meningitis can be caused by bacterial or viral infection. That infection can get to the brain from the nose or throat. Typically, the pia mater or the arachnoid mater are the two layers affected. The dura mater can be affected, though. When this happens, we see swelling of the brain and possibly consequences as severe as brain hemorrhaging. Early symptoms can include a fever, stiff neck, drowsiness, sleepiness, and a very, very intense headache. Coma can happen within just hours of onset of symptoms. In order to diagnose meningitis, we look for markers in the cerebrospinal fluid, the CSF, and we would have to do a spinal tap or a lumbar puncture in order to determine that. So we have 4 chambers inside the brain. We call these the ventricles. There are two lateral ventricles, one in each of the cerebral hemispheres. We have one that's in the space beneath the corpus callosum that kind of integrates the left and the right hemisphere. And then the 4th ventricle is between the pons and the cerebellum. Okay, so 4 ventricles. And then the choroid plexus is a little mass of capillaries that we see on the floor of each one of these ventricles. And the ependyma is a specific type of neuroglia that lines these ventricles and ultimately produces the cerebrospinal fluid. So now we're going to talk about cerebrospinal fluid in relation to these ventricles. So the CSF is clear liquid, fills up the ventricles, and then some connecting canals. Essentially, the entire external surface of the brain gets a thin layer of this cerebrospinal fluid around it. We produce about half a liter of CSF each day. The greatest percentage of it, not the majority, but the greatest percentage of it comes from that subarachnoid space. Again, this is outside of the brain, but interior of the skull. We do get some of it from the epineal epinedymal lining, of those vesicles, and then another significant amount more from the choroid plexuses. We mix the CSF by altering the blood plasma. So the blood plasma comes into capillaries into the brain, and then the ependymal cells modify that blood that has come through the capillaries, adding more sodium and chloride, but having less potassium, calcium, glucose, and only a very small amount of protein as compared to regular blood. So being kind of pushed gently by the cilia and pulsations that the brain has with each heartbeat, the CSF kind of flows around the central nervous system. It gets secreted from those lateral ventricles that we talked about a minute ago, and then through into the third ventricle, and then it goes to the fourth ventricle, and then the third and fourth ventricle add more cerebral spinal fluid because those areas are producing cerebral spinal fluid and kind of keep the CSF flowing. There's a canal that surrounds the spinal cord that is filled with CSF that's kind of moving along there. There are a few places, 3 pores specifically, that cerebral spinal fluid can escape from. And it can also be reabsorbed by granulations in the arachnoid layer. Cerebrospinal fluid performs several really important functions for us. First of all, it provides buoyancy. Okay, so it allows the brain to kind of support its own weight. It allows the brain to float without getting mashed by gravity against the base of the skull. If we didn't have the cerebrospinal fluid and the brain was just kind of sitting on the base of the skull, it would damage and maybe even kill some of the nervous tissue. The CSF gives protection from any striking force, like a car accident or just generally bumping your head. It prevents your brain, at least to some extent, from getting bruised with any sort of jolt that happens. CSF is not able to prevent all injuries, though. We've all heard of shaken child syndrome, where even though cerebrospinal fluid is providing some cushioning, the brain can be injured by severe shaking. Cerebrospinal fluid allows us to maintain homeostasis of the chemical environment surrounding the brain. Even though the brain is a very, very small percentage of the adult body weight, it receives a lot of the blood, 15%, up to 3/4 of a liter per minute. The neurons in the brain need a lot of ATP for energy. So oxygen and glucose are also important in providing the brain the nutrients it needs. If we see an interruption in that blood supply carrying ATP, carrying oxygen, carrying glucose, of even 1 to 2 minutes, we may have significant brain damage. 4 minutes without oxygen, glucose, and ATP, we can expect irreversible brain damage to take place. Even as short as 10 seconds, interrupted blood flow can cause a person to lose consciousness. It's very important that we have a continuous supply of oxygen and glucose and ATP to the neurons of the brain. Okay, so now on to the blood-brain barrier system. So in a nutshell, the blood-brain barrier system determines what can get from the bloodstream into the CSF surrounding the brain. We need blood, but the blood also has some things that could harm the brain. So we have to be very guarded in the way that blood gets to the brain. So the blood-brain barrier is a series of protective blood capillaries that extend throughout the blood tissue. And they consist of epithelial cells with tight junctions in between them, and astrocytes that reach out and interact with the capillaries, and that seals off all the gaps between the cells. So we don't have any leaking going on. The choroid plexus is a really important point on this blood CSF barrier. We have between the ependymal cells more tight junctions there, and this allows for a controlled exchange between the blood tissue and the CSF. The blood-brain barrier system freely allows water, glucose, and some lipid-soluble substances, oxygen for one, to cross that blood-brain barrier. Other substances that are able to cross the blood-brain barrier pretty easily are alcohol, caffeine, and nicotine. So that's part of the reason those things have such an intense effect on our cognitive function. The blood-brain barrier system, it can make it challenging, though, to deliver certain medications and other drugs to the brain. A lot of things like antibiotics or chemotherapy drugs get stuck at this blood-brain barrier. They never make it to the brain. So if we're treating infections or trying to control uncontrolled tumor growth in the brain, this brain barrier system really gets in the way. We need to find creative ways to circumvent it.